Audible?
Yes, you are audible.
Honorable Chairperson, respected panelists, distinguished audience, I'm Dr. Mohammad Raushun Masood, Associate Consultant, Cardiology, Asghar Ali Hospital. Today my topic is giant left atrial appendix aneurysm, a rare congenital heart disease. We present a case of 20 years old gentleman with congenital left atrial appendix aneurysm. The individual in this manuscript has given written informed consent to publish this case details. Left atrial appendix aneurysm is extremely rare. It can be caused by congenital dysplasia of pectinate muscle or secondary to mitral valve disease. Herein, we present the case of 20 years old gentleman with congenital left atrial appendix aneurysm. Furthermore, we review law-related literature published from 1962 to 2016 to provide detailed information about its symptom, diagnosis, treatment, and progress. Case history of this patient: a 20 years young man presented to our hospital with chest discomfort for 1 month, chest pain more in back, no relation with exertion. There is no history suggestive of rheumatic fever. He underwent some non-invasive cardiac checkup, 12 lead ECG revealed sinus tachycardia, chest X-ray PA demonstrated cardiomegaly with tented left heart border. Two-dimensional echocardiography revealed giant left atrial appendix aneurysm looked like fifth chamber of the heart. See some still image. RV, this is RV, LV, and this is left atrial appendix aneurysm. This is modified view. This is LV. This is left atrial appendix aneurysm. Left atrial appendix aneurysm is almost double the left ventricle, just measuring more than 46 centimeters square. Let's see some video. This is modified view. This is left heart border. Left atrial appendix aneurysm push the left heart border. This is apical 4 chamber view. This is color Doppler, echo. Finally, cardiac CT scan confirm the diagnosis. Look, this is left atrium, and this is left atrial appendix aneurysm. How giant it is. CT chest showing enlarged heart shadow and tinted left heart border. Cardiac CT scan with contrast to further delineate the anatomy of this large cavity and its surrounding structure. The pericardium was noted to be intact. Therefore, the echocardiography findings are verified and the diagnosis of LA was confirmed. We reviewed PubMed from 1962 to 2016 to find relevant LA cases. Overall, only 89 case reports and 6 case series of LA was identified. Epidemiology and pathology, first reported in 1962, it occurs among all age groups, and there is no gender difference in prevalence of LA. It has been classified as congenital or acquired. 90% patient are congenital. The reason is not clear, although the anomaly are probably due to congenital dysplasia of atrial pectinate muscle. Acquired LA is often secondary to mitral valve disease or other condition leading to elevated left atrial pressure. The common histopathological findings of both congenital and acquired LA is fibrosis of the myocardium or endocardium, hypertrophied myocardium with an increase in interstitial fibrous tissue may be seen. It may be associated with other congenital anomalies like atrial septal defect, ventricular septal defect, pulmonary venous drainage, cleft mitral leaflet, tricuspid atresia. Clinical symptom: The symptom associated with LA often occurs during the second to fourth decades of life. One-third patients are asymptomatic and are diagnosed incidentally. The main complaints is palpitation, dyspnea, chest pain, and thromboembolism. Methods used to diagnose LA include chest X-ray, echocardiography, CT, and MRI. Chest X-ray reveal enlarged left heart border. It might be interpreted as pericardial cyst, cardiac tumor, or mediastinal mass. ECG reveals atrial arrhythmia, supraventricular tachycardia, atrial fibrillation, or flutter. Echocardiography is considered to be primary methods of diagnosis. It shows a large saccular structure associated with left atrium. Color Doppler echocardiography can also confirm the exchange of blood between the aneurysm and the left atrium. Transthoracic echocardiography diagnosed only 24% patient due to limited echo window. Transesophageal echocardiography provides clear visualization of the structure surrounding atrium, making the effective for the diagnosis of LA. According to our data, TE identified 30 cases with 36 patients who underwent TE. In the remaining 6 patients, the findings was reported either as enlarged left atrium or pericardial cyst. Due to its precise delineation, TE should be mandatory if the diagnosis is ambiguous after evaluation of transthoracic echocardiography. Other imaging modalities include CT and MRI. MRI has highest temporal resolution, making it optimum approach for assessing the surrounding structure and cardiac anomalies. CT helps to evaluate the anatomy of the coronary artery if compression of the left coronary artery or its division is suspected.
Please do short. Time is limited.
Management of LA, surgical, 1 minute. Surgical treatment is often recommended even in asymptomatic patient, as it can be prevent the potential thromboembolic complication and the treat associated atrial arrhythmia. A variety of surgical approaches for surgical resection have been approved. Let's skip some. In conclusion, LA is rare cardiac anomalies. Echocardiography is considered the initial diagnostic tool. The cardiac CT as well as MRI helps to differentiate it from the other abnormalities. The associated high risk of life-threatening complication and the relative ease of surgical removal suggested that prompt evaluation should be considered in patients with lesion adjacent to the left heart border. Take-home message: the left atrial appendix aneurysm is a rare congenital malformation resulting from dysplasia of pectinate muscle. It can be incidentally discovered on echocardiography or can manifest as atrial fibrillation, thromboembolism, or heart failure. Management strategy ranging from conservative approach using anticoagulation to surgical approach with aneurysmectomy. Thank you for patience hearing.
Thank you very much for your excellent presentation. May I request to stop the screen share, please?
1 minute.
Now I am requesting our chairpersons and panelists to discuss the case, please. Is there any question? Shana madam, unmute please.
I just want to share our experience. Am I audible?
Okay, ma'am.
Can I share my experience?
Yes, ma'am.
Okay, we have also diagnosed a case of giant left atrial appendage aneurysm in a female. She presented with arrhythmia, and the patient was operated by our cardiac surgeon, Dr. Prashant Kumar Chandu, and she is doing well. So congratulations, Dr. Roshan, for diagnosing another case in Bangladesh.
I have a question.
He is also operated few days back.
I have a question to Dr. Roshan Masood. Am I audible?
Yeah.
You are audible.
First of all, thank you for presenting a very beautiful and rare cases to us. First of all, your case is rare as a disease and rare as a presentation, as left atrial appendage aneurysm may represent with atrial arrhythmia, thromboembolism, or heart failure.
Yeah.
Then I'm asking whether this patient has any video echo clip or echocardiographic evaluation after aneurysectomy or after surgery. It will help us to see the
Yeah,
yes, to compare before and after.
yeah.
If
Surgery,
you have this, you can share with us.
yeah.
Thank you.
Surgery done, but he's not come to our hospital. Thank
So
you.
follow-up echo was not done.
Yeah.
Okay.